Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us, as always, is Dr. Hinshaw, Chief Medical Officer of Health for the province. Dr. Hinshaw will provide a brief update, and then we will open the floor to questions.
Thank you, Tom, and good afternoon, everyone. Before I get to today's COVID-19 update, I want to provide an overview of the unique influenza season that we've experienced in Alberta this year. This year's influenza immunization program has ended for the general public, except for children under the age of 9 who have only received 1 dose of the vaccine. These children can get their second dose until the end of April. This season has ended like no other, with 0 reported cases of seasonal influenza in Alberta. I know some may wonder if it's because we didn't test as much, but actually the opposite is true. More than 122,000 respiratory swabs were tested specifically for influenza, compared to less than 47,000 at this time last year. This was also a record-breaking year for the uptake of influenza vaccine. More than 1.6 million doses were administered, the highest uptake we've seen in over 10 years. We are not alone. Current data globally indicates that influenza activity has been lower than expected, with several countries reporting few to no influenza cases. We know that public health restrictions currently in place to prevent the spread of COVID-19, such as enhanced hygiene and physical distancing, have had an impact and provided protection against the spread of influenza. This is a reminder of the power of our collective actions. Through effective immunization and practicing good hygiene, physical distancing, and staying home when sick, we have prevented the spread of influenza and other respiratory illnesses. At the beginning of the season, we urged all Albertans to get the influenza vaccine and to do what they could to protect our healthcare system from also having to deal with the additional strain of influenza cases. Together, we were successful in keeping influenza out of our hospitals, workplaces, schools, and communities, and that is an incredible triumph. I want to thank Albertans for getting immunized and for protecting each other from influenza, COVID-19, and other respiratory illnesses. This success reminds us that we can beat COVID-19 as well if we work together. Turning to today's update. Over the last 24 hours, we have identified 1,081 new cases of COVID-19 and completed about 12,000 tests. Our positivity rate currently stands at 8.9%. We have identified 705 additional cases of variants of concern in the last 24 hours. Variants currently represent about 52% of our active cases. There are now active alerts or outbreaks in 453 schools, which represents 19% of all schools in the province. A total of 2,653 cases have been linked to these schools since January 11th. We are seeing a sharp rise in cases in school-aged Albertans as well as those in all other age groups. While there are no risk-free options with COVID-19, the rise we have seen is not attributed to any single cause, and in fact is often linked to social gatherings outside school rather than transmission within classrooms. This reinforces the importance of following the measures in place, not only during school hours, but before and after them as well. There are now 402 people in hospital being treated for COVID-19, including 88 in the ICU. Hospitalizations are increasing province-wide, and cases continue to rise sharply. My team is monitoring closely, and if we do not see growth slowing soon, further measures may be required. Sadly, I must announce that 3 new deaths were reported to Alberta Health in the last 24 hours. My condolences go to the family, friends, and loved ones of these individuals who are mourning their loss, and to anyone who is grieving a loss at this time. I am pleased to report that we have now administered more than 900,000 doses of the vaccine in Alberta. I want to encourage anyone who is eligible, all 1.7 million Albertans, to book your appointment as soon as possible. There may be some questions about who can book appointments right now, so I want to be clear that anyone 16 or older who has a medical condition like diabetes, COPD, severe asthma, heart disease, or any other conditions on the list available at alberta.ca is now eligible. In addition, this week we have opened eligibility for all those who work in healthcare settings as part of the in-person care teams providing care in community clinics, acute care settings, and other healthcare locations. Please check the website at alberta.ca to find out more about who is currently eligible and how employers can provide letters to their employees to verify their role at the workplace. If you have already been immunized, thank you for making the choice to protect yourself and your community. If you've tried and the pharmacy or clinic near you was full, please try again. We are making more appointments available as more vaccines arrive. I know there are still many others in Phase 2C who are patiently waiting their turn. We will open up to the rest of Phase 2C in the coming weeks. Thank you for your patience, and I can reassure you that your wait to choose protection for yourself and those around you is almost over. Research shows that the first dose of Moderna or Pfizer vaccine offers a huge boost in immunity, with Canadian data indicating around 80% protection against infection after the first dose. AstraZeneca's first dose reduces infection by 60 to 70%, and importantly, hospitalization risk is reduced by about 80%. The second dose for both of these vaccines increases protection even more and is necessary to complete your series. However, I also want to stress that vaccines do not mean that we simply stop caring about COVID-19. These vaccines are remarkably effective at preventing severe illness and death, but it takes several weeks for your body to start developing immunity, and even then, it cannot offer 100% protection. Looking at levels of transmission in our communities right now is like watching a flood rise higher and higher. Vaccines are building a barrier against this flood to protect our communities from becoming overwhelmed. But until everyone has had a chance to receive vaccine, we cannot dismantle the existing barrier of our collective actions to prevent spread. And this includes the same protective actions in those who are immunized. With high levels of community transmission, the 5% of people who can still become infected after a second dose are still unfortunately able to expose those around them. This is also the reason that we are looking closely at emerging evidence to determine the safest way to relax any restrictions in place at continuing care facilities and other high-risk settings. And we are seeking input from residents, family, staff, and operators to make changes based on their feedback. That said, the very small risk of post-vaccine infection that could occur pales in comparison to the risk that comes without the vaccine. These vaccines work, even against variants. The evidence available indicates that all three vaccines that we currently have, Moderna, Pfizer, and Covishield's AstraZeneca, effectively stop the variant that's most dominant in Alberta, the B.1.1.7. Vaccines are our best defense, and once we have been able to offer them to all in the province, the current wall of protection created by public health measures can be replaced with this wall of protection that the vaccines give us. I want to end today by saying that I know this last year has been a long road. This pandemic has challenged all of us in many, many different ways. It is natural to feel frustrated, anxious, and eager for the situation to change. It is understandable to have different opinions about the measures in place, the responses we take, and how to move forward. But cases are rising. We have no choice but to keep working together and keep following the measures in place, even if you disagree with them, for a little while longer. The recipe for getting safely to summer is simple. We need to reduce cases sharply by limiting in-person interactions as much as possible every day. We need to stop the spread for just a few more months so that vaccines can do their work. We are getting closer to this every day. Thank you, and I'm happy to take questions.
All right, we'll go to the phone now. Operator, could you put through the first caller, please?
Thank you. Yes, the first caller is James Keller, Globe and Mail.
Hi, Dr. Hinshaw. I wanted to ask you about the protests over the weekend at Grace Life Church and surrounding those issues. The Premier has condemned what has essentially become a kind of a ragtag group of conspiracy theorists with some really caustic language at the government, the Premier, and you in particular. So I'm wondering, what do you think of these demonstrations, which seem to be growing, and what do you make of the current antipathy towards the public health measures and public health officials?
First of all, I want to say that there are 4.4 million of us working our way through this incredibly complex situation, the most significant health crisis that we have faced in 100 years. And that it is understandable that people who, as we all have, had things taken away from us by COVID-19, that it's understandable to feel angry. It's also critical that we choose how to use that anger and choose how to respond to those emotions. It's critical that all of us think about how we can support our communities, how we can work better together, and focus on the things that unite us, which are much, much more plentiful than the things that divide us. The individuals who are choosing to protest do not speak for the majority of Albertans. And I want to be clear that while, again, it's understandable that people feel frustrated and angry, it's critical that we use evidence, that we use the best available information about what's happening here in Alberta and learn from other places around the world to protect our communities against what could be a very significant wave of COVID-19. It's really important that we all look to respectful dialogue across our differences to be able to get through this next set of difficult months.
James, is there a follow-up question?
Yeah, I mean, just given the current climate, and have these issues raised any concerns about your own personal safety, and have you had to take any additional steps in that regard?
You know, this pandemic isn't about me, it's about all of us working together. And again, I just want to emphasize that every single one of us is in the same position of needing to respond to COVID-19 and look to our communities as the ultimate goal of protecting our communities with our actions. And so again, this is something that we're all in together.
Operator, could you put through the next caller, please?
Julia Wong, Global News.
Hi, Dr. Hinshaw. You've previously said that there is surge capacity to screen up to 1,000 samples a day for variants of concern if needed. Now, case numbers have been on the rise. Yesterday, we were over 1,000. What is the maximum capacity now for screening for variants every day? And if it remains up to 1,000, what, if anything, is being done to expand capacity?
Our provincial lab for public health in this province is amazing, and they have been able to expand the capacity to be able to do rapid screens of up to 2,000 samples a day at this point. If we exceed that number of new cases a day, it will not be reasonable to continue to screen all of them. And at that point, we would switch to a surveillance strategy where we target screening at outbreaks, high-risk settings, and geographical samples across the province. But our lab has been able to expand, as I mentioned, and so anticipate we will be able to continue screening for variants up to 2,000 samples, up to 2,000 new cases a day.
Julia, is there a follow-up question?
Yeah, I just wanted to ask quickly about the Johnson & Johnson vaccine. Obviously, no shipments of that have arrived in Canada yet, but do the concerns south of the border about blood clots change distribution plans in Alberta or change the age demographics who could potentially receive this vaccine?
We're watching very closely what's happening in the United States and working with other provincial, territorial, and of course federal partners in assessing the evidence as it comes available. We know that Johnson & Johnson and AstraZeneca use the same kind of vaccine technology, which is a viral vector vaccine. And so we're looking very closely to see the outcomes of what is being done in the United States, the investigation that's underway. And we would use that information, again, in conjunction with discussions nationally to determine if we would need to make any changes to how we would use that particular vaccine.
Operator, can you put through the next caller, please?
Kevin Nimick, CTV Calgary.
Hi, Dr. Hinshaw. I just wanted to follow up on James's question about your safety. Do you have any concerns for your safety, and is anything being done by Alberta Health to provide you extra protection of any kind?
I want to reiterate again that it's critical that we remember that this COVID-19 response is not about me, it's about all of us. I am well supported in ensuring that if there are any emerging safety concerns, I have the support needed to deal with them. But I also want to reiterate that I know that those who have been expressing their concerns in ways that perhaps overprivilege, again, anger over thinking about our communities, do not speak for the majority of Albertans.
Kevin, is there a follow-up question?
Yeah, Dr. Hinshaw, the Premier says Alberta can get back to normal by this summer. He also says that people who have previously had COVID-19 have immunity. Is that true, and is it realistic to set these goals for the summer?
We've been looking very closely at the experiences of other countries around the world who have rolled out their immunization programs more rapidly. And I think it's critical to remember that COVID-19 is a significant threat to individuals, again, the most significant threat to those who are older, who have health conditions. It can, of course, cause severe outcomes for those who are young and healthy, but the risk is much lower. And so what we're looking at for the summer is we're looking at the ability of the vaccine, once we're able to offer it to all Albertans and start rolling out our second doses as quickly as possible, that we believe we will have the ability to, while we may continue to see some infections, that the impact on our acute care system can be significantly mitigated with what we anticipate will be our vaccine rollout at that time. There are two important things to consider when we think about that. One is that strategy will work if we are able to reduce the volume of infections right now, because as I mentioned, our vaccination program can build a wall of protection that's effective, particularly after the second dose, but if the flood of new infections is greater than our ability to contain it, that could delay that opening strategy. And the second thing that's really important to remember is, again, that we need to make sure we're considering both the protection of the first dose as well as the second, and take that into account as we're planning forward.
Operator, could you put through the next caller, please?
Rick Bell, Calgary Sun.
Good afternoon, Doctor. At the beginning of the press conference, I think you said if we don't see growth in cases slowing soon, further measures may be required. The Premier earlier today also talked about the possibility, not the inevitability, but at least the possibility of further restrictions. Could you explain in a little more detail what that means for Albertans, the idea that if we don't see growth slowing soon, further measures may be required? And can you define what soon means as well?
Sure. So essentially, we know that when we see our case count rising, that our hospitalizations and ICU admissions will rise in the weeks to come. And there's typically, and this is what we saw in November, December, there's typically a few-week lag between when our cases peak and when our hospitalization and ICU admission numbers peak. So in early December, the first week of December, we saw the highest level of new cases. And about 3 to 4 weeks after that was when we saw the peak in hospitalizations. That's important to remember, because what it means is that we don't have right now the level of vaccine protection to prevent people who get sick from needing to go to hospital. And so as our new cases rise in the coming days and weeks, if they continue to do so, what we know is there will be a subsequent rise in hospital and ICU admissions about 3 to 4 weeks later. So we need to make sure that we don't wait too long. We cannot wait 3 weeks and watch. We have to make sure that we're watching within the coming week to 10 days about what those cases look like, and consider if our trajectory continues on a steep upward climb, whether those additional measures will be needed. What specific measures might be needed, what that would mean for Albertans. Again, those decisions will be based on what we're seeing with respect to our numbers, where we're seeing that significant amount of transmission, And I want to really reinforce that what is critical right now is for every single one of us to limit our in-person interactions every single day when we're in person present with somebody outside our household, stay distanced, wear a mask when we're indoors. And those are the kinds of things that we can do right now. And we don't have to wait for any additional measures. Those measures, again, may be required if what's currently in place does not bend that curve.
Rick, is there a follow-up question?
Yes, just so I'm clear, Doctor, so when, if the trajectory that you see continues, so I'm clear, are we looking at like 7 to 10 days before you have the kinds of discussions that might lead to further measures? I'm just trying to get sort of a timeline. Like, could there be, I'm not saying there will be, but could there be further measures needed in 7 days, in 10 days, in 14 days, in 21 days? Like, what is the timeline where that might have to occur? And let's say you do have to do the additional measures. How do you communicate that or sell it, if you will, to a population where polls say half the population think the restrictions now are too strict? So it's kind of a two-part question. But the first part is the days. Could you be having a discussion with the COVID committee next week or the week after about new measures, and if necessary, and just how do you sell it to Albertans, half of whom don't like the measures that are in now? Thanks.
Sure. We regularly discuss the current state of COVID-19 in the province with the COVID Cabinet Committee and regularly give presentations on where we're seeing spread, what the trajectory is. We have seen an increase in all parts of this province, and in fact, if you look at the different health zones of the province, every single health zone has experienced a significant increase in the past while. So the question about how soon could we see measures or how soon would we have those discussions, it really depends on what cases we're seeing and the trends that we're seeing. So as I mentioned, potentially, again, no decisions are made. Whether or not there could be something within the next week really depends on the situation and how quickly things accelerate. But I think, again, the reason that it's difficult to be able to give a precise timeline, I understand people want predictability. They want to be able to plan. But unfortunately, again, COVID-19, we can control it by the means that we have put in place, but we need Albertans' help to do that, which leads me to that next question about selling it to those who feel that the current restrictions are already too much. And I think, quite honestly, what's important is, again, to remember the impact that COVID-19 had on our hospital system in December, and the potential, given that the variants of concern are even more infectious, and in the case of B117 appear to be even more severe, that our hospital system could have an even larger impact than we saw in the winter unless we intervene. And ultimately, I understand that Albertans are tired of this. They want their lives back. They don't want restrictions. That's, I think, true of all of us, that we would prefer to not have restrictions in place. But the reality is that until vaccines are in the majority of Albertans' arms, all that we have to protect our health system is these public health measures. And that's the truth that we will share with Albertans, that we continue to share with Albertans, is that we depend on each other to take these measures so that we continue to have the capacity to care for people with heart attacks, strokes, car crashes, and other things that happen every day. And we need to keep health system capacity open for that by limiting the spread of COVID-19.
All right, we've got time for 2 more callers. Operator, could you put through the next one, please?
Audrey Naveau, Radio Canada.
Hi, Dr. Hinshaw. I saw that Quebec today reported its first case of blood clot in someone who got its first dose of the AstraZeneca vaccine. I want to know if that changes anything for Alberta's rollout of the AstraZeneca vaccine.
I have seen the reports from Quebec, and this report is consistent with what we knew about the vaccine when several weeks ago we changed our criteria, when we learned from Europe that the incidents of blood clotting that they were seeing were not limited to a single batch, and when we learned that the incidents, again, ranged in magnitude from the countries that reported it, but the estimate was about 1 in 100,000. So again, this is a very rare condition. It can happen in those who've received the vaccine. This is something we've been communicating to the public about. It's also important to know that with quick treatment, this can be dealt with. And we also know that the AstraZeneca vaccine, as I mentioned, is highly effective at preventing severe outcomes from COVID-19. So this does not change our current program in Alberta. We continue to make sure that all of our clinicians have the information, that the public has this information, and that they know that there is this rare risk, but also that this vaccine will provide benefits to those who receive it.
Is there a follow-up question?
Yes. So a different topic, though. What's the likelihood, in your opinion, if everything goes well in terms of vaccination, that we could hold large public events like Calgary Stampede this summer?
If we have high enough uptake of vaccine, so I mentioned earlier that idea of that wall of protection, if we can build a strong enough wall of protection, and if we're able to turn our cases and our hospitalization numbers down, I believe that it's possible we could have large events this summer. They may look a bit different in terms of masking, distancing, some alterations in terms of indoor events. However, again, this is about two things: our ability to reduce our cases and that burden on the healthcare system, and the collective effort to get as many people vaccinated as possible. And if we're able to do that, I think that it is possible we could have large events this summer.
Operator, could you put through our final caller, please?
Thank you. Lauren Pullen, Global Calgary.
Hi, Dr. Hinshaw. Thanks for taking my question this afternoon. We've seen cases top the 1,000 mark for the past week. I just want to check in on contact tracing. Are the contact tracers able to keep up? Or, and we know that more tracers have been hired, but the unknown number still remains at about 32% in terms of source of COVID-19, where people have picked it out from.
The contact tracing team at Alberta Health Services continues to do an excellent job, and they are able to reach all new cases within 24 hours, and in many cases it's shorter than 24 hours of their initial test result coming back positive, and then able to reach out and make phone calls to all of the contacts they identify. So the contact tracing team, again, is able and have demonstrated their ability to manage even with this surge. It's important to remember that 30% where we're not quite sure where people acquired it from isn't a representative. It doesn't represent people who didn't get a phone call. It's people who perhaps got sick with COVID-19, but it's not possible to identify in the activities that they participated in the 14 days before they got sick, where they perhaps got COVID-19. And again, that's always been an important thing to keep in mind as we look at our data, that about 2/3 of the time we can identify where someone got it from, but especially if people are participating in many different types of activities with different people, it's not always possible to identify exactly what the source was. And that's, again, why it's important to reduce the number of people all of us interact with every day, so that we reduce the chances that spread is happening, and also help us understand more specifically where we are seeing spread.
Lauren, is there a follow-up question?
Yes, thank you. We have seen, obviously, the variants of concern cases rise within hospitals, and both yourself and the Premier have noted the more severe outcomes to younger people. Are you able to provide a breakdown of what we're seeing in Alberta hospitals, the ages of people specifically, and if they're having underlying health issues in order to get them into hospital, or what we're seeing with those VOCs in hospital in Alberta?
I don't have a specific breakdown in front of me. That's something that we could provide offline. We have been watching our data closely to see if we're experiencing the same trends that have been reported, for example, in Ontario. It's important to remember that for each particular age group, we have heard from the UK, from Denmark, from Ontario, that there's approximately a 60% increase in the risk of hospitalization with infection with a B117. For younger people who have a relatively low baseline risk, even a 60% increase still may mean that we wouldn't see that difference until we have more people who've been infected, which we don't want. So at the moment, we haven't actually seen a significant difference locally, but that's likely because the volume of cases we would need to see that difference, we haven't reached yet. But we do believe, based on the experience of many countries around the world and more locally in Ontario, that as cases rise, we will begin to see that differential emerge. What's critical to remember is that any kind of COVID-19 can cause severe outcomes, whether it's B117, whether it's the original strain, whether it's P1 or B1351. Any strain of COVID-19 can cause hospitalization, ICU admission, and of course, in the severe cases, death. So we all need to make sure, again, that we take those precautions every day, because we never know when it's possible we might be exposed or potentially exposing others.
Thank you all for joining us. Dr. Hinshaw will provide another update later this week. Have a safe evening.